Hey there, this is Eric Leafgreen, VP of Provider Compensation at Ludi. Happy to be with you today. We're just going to do a quick rundown on some common hurdles when calculating work RVU payments for your providers, both your physicians and APPs, if they have incentives based on work RVU production. This is a very challenging area to make sure that you properly calculate the work RVUs. One of the first things I like to look at is, are you pulling data at a claims level? So an individual transaction that was with a patient and a provider. Or are you pulling data for a procedural report that compiles data from multiple transactions into one report, then calculating work RVUs? That can have a big impact on the total work RVUs that you report for each individual provider. Another area to look at is the dates. So are you pulling and compiling transactional data based on post date or service date or some other date? Now this is an area too that can be a little confusing depending on your EMR. The nomenclature that they use for post date could be a little bit different among EMR systems. So that's an area to make sure that you really dive into the details. Are you really pulling post-date information? This one is a little bit more controversial, especially when you're using physicians that are using APPs in the delivery care, or you're using billing provider, rendering provider. You might hear this as a service provider there. So that can have a pretty big impact if you're pulling billing data or rendering detail. It's important to make sure you have your compliance folks and your legal team involved when you're configuring and picking out that type of payment. Another areas to look at is, are you adjusting for the modifiers? And those are the 2-digit codes. How many modifiers are you using? Are you going out 3 levels? Are you just picking up the visual modifiers? And then lastly, are you looking at the modifier indicator, the payment indicator for that particular type of modifier? That certainly can have some impacts. For an instance, if you're an ENT, an orthopedic surgeon, you have a lot of different types of modifiers out there. Not every single modifier is applicable for that particular code in that scenario. So you need to make sure that you're going down to the level when you're picking out the Medicare physician fee schedule, or you're looking at the payment modifier, the indicator for that particular modifier. Are you doing a review every year of the Medicare physician fee schedule, looking at the additions, the revisions, and the deletions for those codes, updating it for any codes that you use internally, like those house codes, or maybe you provide some service in kind for a provider that does community outreach, or are you granting work RVUs for that type of service? Another common area that is a really big issue if you're doing a lot of acquisitions. So if you're out there doing a lot of transactions where you're acquiring physician practices and you're relying on work RVU data, it is really important to understand how that data is being calculated. And best practice, I would say, is recalculate it yourself. Ask for the raw data, calculate it using your procedures and the tables that you have, to make sure that there's no misconception after the transaction. So you wouldn't want to have a valuation that relies on incorrect work RVU data, or build out a future compensation model that was built on incorrect assumptions for your work RVU production. That's what we have today. Thank you for joining us. Take care.